I'm Aaron Ratner. I'm an emergency medicine physician at St. Luke's at the Monroe County Hospital, so close by. I don't live anywhere near here. I live about an hour south. It's my favorite town.
Great.
Jen Misero asked me, so one of our nurses asked me to come and talk today, and I mean, informal. I'm an incredibly informal person, so if you have questions, I'd be happy to answer them. They kind of asked me to put together, who I am and where I'm from. So, I practice emergency medicine now, so it's 4 years of undergraduate education after high school and 4 years of medical school, and my residency was 4 years. And I've been working in this area now since the Monroe County Hospital opened. So 5 years ago, I've been with St. Luke's for 7 years.
Okay.
Worked with Lehigh Valley before that. My background is emergency medicine also. I've been a paramedic for 29 years now.
Okay.
So I started as a firefighter EMT when I was 16. So I did that through my last 2 years of high school. Lived in my firehouse in my senior year of high school, which was great. And then after high school, actually graduated, moved to Israel, spent 3 years as a combat paramedic in the Israeli army, and then moved back here to do my undergraduate work. That's really that part of the story.
Where did you go for school?
Which school? So medical school I did at the Philadelphia College of Osteopathic Medicine. You guys know the difference between an MD and a DO? Most people don't. Like, you hear doctor and they're like, oh, MD. So there's 2 degrees in the United States for medicine. One is the doctor of osteopathic medicine. The other one is the MD, medical doctor. The biggest difference between the two, or some of the big differences between the two, MDs are worldwide. So if I wanted to go to Europe to go to medical school, I would end up with an MD degree. Pick a country, MD. United States is the only country right now with both. So the doctors of osteopathic medicine started about 115 years ago or so by an MD whose whole entire family died from the flu. So we think COVID is bad, but you take like flu the way it used to be, they treated it with mercury. So he killed his whole family, wife, bunch of kids. He's like, we've got to do something better. Like, this medicine, it's not working. So considered a little bit of a crazy person at the time, dug up a whole bunch of bodies and started trying to figure out why these people died. And what he started realizing was that people with diseases had structural abnormalities that weren't being treated. So he came up with this idea that structure and function are interrelated. So a person with asthma will have changes in their ribs. A person who has back problems is going to walk funny. Different disease processes cause different structural abnormalities, and his concept was, let's treat the structural abnormalities and help that person's innate ability to heal themselves. He was one of the first people to understand we have an immune system that didn't really exist back then. It existed. We didn't know it existed. And he started trying to look at how he could do things to enhance a human's ability to heal themselves. So the osteopathic group of medicine essentially takes structure and function in the disease process, and we learn all of that together. So we do a lot of what people would call like chiropractic type things. So if I'm at work and a nurse's back hurts, I can pop their back into place, and we can go on our merry way and practice the same medicine that an MD would with that additional bit that we learn, which is cool. I like it a lot, and I like the school that I went to. I chose my medical school because they were playing hockey on the roof. That's what it took. I mean, I went from place to place, and students were miserable. Like third-year medical students, if they were on the roof, I figured they were going to be jumping off. This place, third-year medical students, we were up there, they were playing hockey. Right? That was my orientation to the school. We were up there, having a good time, learning. Take learning seriously, but still being able to enjoy life with it becomes really important. Otherwise, you do this all day, and it's awful. Probably shouldn't be saying that to students. So, you guys have any questions for me so far?
What made you
You have to raise your hand. There's only 3 of you. Speak freely.
I want to take an EMT course.
Good.
And do that, and then I'm not really sure after. So what made you pick going in the service?
And into EMS? I knew since I was 4 years old that I wanted to be a doctor, and I knew from the time that I was 6 that I wanted to be a paramedic.
Wow.
So I was that annoying kid that was constantly bugging my parents every year in my firehouse, and I lived in I hate to say small town, it was a suburb of DC, but it was a fairly small town at the time. We went to that firehouse every single year. I went to their open house. They knew me. They knew the date that I was coming in to fill out my application when I was 16. Literally met me outside the door with it. I always liked chaos. I love, if I go into work and there's patients in the hallways, there's 50 people in a 30-bed ER, and just all sorts of things. I love that. And I always loved chaos, because to take chaos and turn it into calm that's where I'm like happy. So that's why I knew emergency was always my thing, because I always liked that. And the EMS side of it, it gave me an opportunity to do it when I was young, 16 years old, to be able to be in the back of an ambulance. At 16, you're not really taking care of them on your own, but I was doing a lot. Like I delivered a baby at 16.
Wow.
Yeah, it wasn't pleasant. Everybody did fine. So it's a cool opportunity to do things that, like I did things as a teenager that people in medical school hadn't done yet. I learned how to talk to patients. I learned how to, I wouldn't say that like the medicine was new, but if you can go into something with a clear and cool head and make good decisions, then that's the place for you to be. Did I answer your question?
Yeah,
So in EMTs, like it's an attainable thing. It's something you do now. How old are you?
I'm 15 now.
Yeah, so I think 16, they have Explorer programs around here. It's definitely something to look into. Because it's just, like, I remember in medical school, we have these, it's called standardized patients. So they bring you into what looks like a doctor's office. You have a trained actor who's in there that grades you on everything that you do, your interaction with them, the medicine that you practice with them, everything. And like I walked in and I just had a normal conversation with them. The feedback I would get to them from the very beginning was, you feel so, this seems so natural to you. I've been doing it for 15 years already. I would hope that it would be, but it gets you a head start on, I mean, anything healthcare really. Anything else?
Pick his brain.
Yeah, like this is, it's really hard with
Yeah.
and not that I expected an auditorium full of people, but and I think one thing that I hate is like being a doctor. People are like, you don't act like a doctor. What does a doctor act like? I could come in here with a shirt and tie and a white coat. That's not me. I get dirty. I wear tactical pants because if I don't get blood soaked at the end of the night, that's good, I guess. But it's more fun if I do. And white just shows too much. What other questions?
Anything else about like schooling, since we talked about schooling or any of that kind of stuff?
Could pull up the list of things they told me to prepare for. Got it on my.
I remember.
You have it on yours? Is that what you said?
Oh, no, I thought you said.
Oh, I have.
Oh.
Yeah, I was like, I don't know.
I have a whole list of whatever paper that you gave me. If I can find it. I mean, there's. All right.
That's okay.
There we go. There's plenty of stuff, but a short introduction and career title. I think you get that. Personal career path. The one thing at the high school level that I think that, I mean, looking back, I knew that they were going to take high school into consideration for college, and they would take college into consideration for medical school. So I was not, I took every single AP class they had at my school that was possible. I am not the smartest person on the face of the earth. I worked hard to get to where I was, but I knew that those opportunities were there. So if I could get a little bit more chemistry, a little bit more biology, I did that. So that would be, at least at the high school side, something that I would recommend. Say a brief history of background of your career, company, business. I mean, healthcare has been around for centuries.
You started at Lehigh Valley, you said, so you were always in emergency department position.
Yeah.
So
See,
go ahead. Oh, I was going to say, like, as far as like, I'm not knowledgeable about like Lehigh Valley versus St. Luke's, like trauma wise and stuff like that. As far as ER goes,
there
like,
isn't
levels.
enough billboards out there for you to see.
I live in Wilkes-Barre, so I'm
even
more
better.
Geisinger. You don't
Yeah.
have as much. I have to kind of fund a drive here every day. So
Yeah. You're not missing much. My wife actually works for Lehigh Valley, so
Okay.
it's really funny. But outside of medical school, so you finish 4 years of medical school, and let's say you wanted to be, if it's emergency medicine or internal medicine or whatever specialty, after your it's called postgraduate medical education starts day one after you finish medical school. That's where you subspecialize in medicine. So if you do 1 year of postgraduate education, you can be a family doctor essentially. It's called a general practitioner. Anything more than that, you're going to specialize in something. So if you're a family doctor, they're either internal medicine trained or they're going to be family medicine trained. My training was 4 years of emergency medicine, which I did at Lehigh Valley, mostly at the Muhlenberg campus, but also at the Cedar Crest campus. As far as institutions go, I mean, they're two mammoths. It's if you like business, I mean, that's another aspect of healthcare that I think most people that I like stay away from, just because there's so much silliness when it comes to healthcare right now. If you get traumatic injuries in this general vicinity, you're going to go to Pocono because it's a level 3 trauma center. St. Luke's Monroe is a level 4 trauma center. So we can do Band-Aids and they can do surgery. we stabilize and send people out, they can do a lot more there than we can do at Monroe. They have a surgical team. That being said, that level 3 trauma center would feed into a level 1 trauma center. The closest level 1 trauma centers to here are Allentown, Bethlehem, and then let's see, for Wilkes-Barre, you've got a level 2 trauma center at Wyoming Valley.
Okay, I wasn't sure if
then
Danville was.
Danville's a level 1 trauma center, and I think they're a pediatric level 2 trauma center. That's similar to Cedar Crest, as a level 1 adult, level 2 kids. And the whole level thing, all that means is capability-wise, level 2 trauma center can do pretty much everything a level 1 trauma center can do, but a level 1 trauma center has to have some sort of an academic, like surgical residents that'll be running around also. Most of that's really not interesting either. Did you have a specific question about the 2 networks? Why do they compete so much? Because they want more money?
Well, no, I
I
was just
probably shouldn't
curious,
say
like,
that on camera either, but that's
no,
okay.
I mean, obviously, like your experiences and stuff are going to be different, but I just wasn't sure as far as like the way that the ER ran. You know what I mean? Like, obviously, a lot of it's going to be the same, but like any differences that you've noticed in between.
The same people that I trained with in residency, I probably know half the doctors at Lehigh Valley Pocono.
Okay.
Most of them came out of the Lehigh Valley system, and I trained there, so I know them. We operate very much the same. So emergency medicine as a profession it's a close-knit community where, and in reality, the way it should be is, you could blindfold me and drop me into an emergency department anywhere in the U.S. and I can practice medicine the same way as I would where I am. My hands are my best tool, so that doesn't change from one place to another. Sometimes the equipment is different. Some of the medications may be different, but otherwise, pretty much, it's I won't say universal, but as close to universal as you can get. So you really could practice in any ER anywhere. It doesn't change. Are you guys interested in healthcare? You're here after school. I wouldn't say it's a beautiful day outside. It was earlier, but so what's your interest in healthcare?
I was planning on going into pediatrics.
Okay, why pediatrics?
I like kids. I thought it'd be cool. And I'm still thinking though, I'm not set on it.
Good.
Yeah.
Not knowing is the best thing because it keeps you open-minded. I would say also that's one of my biggest regrets. Like I went through a four-year undergraduate program, and it was all sciences. And my favorite class that I took was the history of American television. It sounds like a fluff course, but it talks about advertising and TV and how you can pick up the different advertising and how you know who's putting their money into the shows that are on there and why, what the ulterior motives are, and I would have missed that if I hadn't needed that one course. I mean, pediatrics, I think a lot of people go into pediatrics because like, well, I like kids. You're okay dealing with sick kids.
Yeah.
You can do office pediatrics is mostly well kids, sniffles. Or you like talk about things like pediatric oncology, which most people in medicine will be like, you want to deal with kids with cancer, you've got to be a special breed of individual to do that. Yeah, just good and bad.
Very true.
How about you guys?
I'm Becca, just you. But like pediatrics, emergency medicine, and like oncology.
You can combine at least 2 of the 3. So there is pediatric emergency medicine. Oncology is luckily a rarity with kids, so that's when you start looking at some of the big hospitals. Lehigh Valley, last I knew, had 2 pediatric cancer doctors. Then you look at a place like CHOP that has probably 3 floors of pediatric cancer doctors. It's an interesting field. It's not something I'd ever want to deal with. But it's wherever you find fulfillment, or if you enjoy going to work, that's really all that matters.
I'm interested in like pharmacists or pharmaceutical sciences, or maybe eventually maybe a physician.
Look at some of the practical pharmacists that are out there. What do they call themselves? I mean, there's pharmacy school, and then they do pharmacy residencies. 2 of my good friends went to pharmacy school, and then one does pediatric transplant. So she works at CHOP, and her husband works at Temple. He does adult ICU. So there's a lot. There's you think about resources. So if I have a complex patient I'm trying to treat with medications I don't use every day, I need a resource. If I have a human as a resource, it's so much better. It's amazing. You think about it, drugs are just our way of manipulating the human body to get the body to do what we want it to do. Somebody understands that the chemistry and the physiology, unless you just want to fill prescriptions all day, which is good too. The retail pharmacists seem to be
There's a
miserable.
lot of different types of pharmacists.
That's crazy.
Work than retail.
Okay.
It's interesting stuff. The chemistry is very interesting. What else can I tell you guys? I keep going through the list. The list is
Do you want him to like describe like I mean, I know you can't describe an average day, but like kind of a general, like, this is what my day looks like?
Yeah.
Okay.
That's a good question, and you're right. Like, average doesn't exist, which is what makes my job fun. Like, today my shift starts at 4 o'clock. Yesterday my shift started at 2 o'clock. So even the timing is different. I think one of the fun things about emergency medicine is truly never knowing what the day is going to bring. So I could go there and it could be a chest pain patient after chest pain patient after chest pain patient, or somebody could get shot and drop them off at the front door. And that's the fun of it. Like, I like not knowing. I like not knowing. I know my shift is 10 hours long, so at least I know that much. One of the good things about emergency medicine is you can leave work at work, and I'm not on call. I don't have to worry about people. I don't have a patient that's going to call me in the middle of the night to ask me a question. We give up in that as we work days, nights, weekends, everything in between. I mean, I don't know what day of the week it is now. I have to look at my watch. I barely know what month it is. I know there's no leaves on the trees, so I can tell you that sometime not in the spring or summer. But you lose that sense. And, with COVID, really wasn't bad for us, all things considered. Recently, though, I mean, my emergency department has 30 patient beds. We have 96 hospital beds, I think is what it technically is. We had 120 to 135 admitted patients at any one point in time, which means those patients are boarded in the emergency department, which means I have no beds to see new patients. So we'll see patients in the hallways and chairs, in cars, in the parking lot occasionally. And that's like I said, I like crazy. So I'm fine with that. If a person came in having an allergic reaction that was not really breathing well and getting really, really sick, we created a new bed in the hallway, which was a chair. Put him in the chair, we start treating him in the chair. One of my paramedics got injured. He got sick. In the middle of the shift, we had no place to put him. I put him in a chair next to me. It just, makes it really easy to keep an eye on somebody when they're sitting there next to you the whole entire time. The typical complaints we generally see in the emergency department, chest pain is a very common one. Abdominal pain is another common one. COVID right now is incredibly common, less over the last 2 weeks, so at least it seems to be this particular wave is waning, and we'll see what comes next. But yeah, there's no typical. That's
Right.
You never know. It would be not my last night work, two night works ago, so this was a week ago. Pretty quiet night. Things were normal, like abnormally normal. The police brought in a person who was a psychiatric patient who needed to be restrained and medicated. At the same time, the radio went off for a 55-year-old who was unresponsive and not breathing. We're getting the room ready for that. They called for another patient whose heart rate was in the 180s or 190s, which is not good. And they needed to medicate them to slow that down. So they're asking for orders on how to medicate them to slow that down. And very quickly, a nice, quiet night went to hell in a handbasket, managing a patient up front who's not breathing, a patient in the back who's gone nuts, and then somebody else who was relatively stable but needed some interventions in order to keep them that way.
So in your ER, like, how many doctors are on shift at one time?
It depends on the time of day. So we stagger our shifts. 7 in the morning, the first doctor of the day comes in. So there's one at 7, one at 9, one at 11. Another one comes in at 1 o'clock, Monday, Tuesday, and Wednesday, because those are our busier days. We have a second doc that comes in at 2, then a 4 p.m. doctor, and then a 9 p.m. doctor.
Oh, wow.
The 9 p.m. doc will be the overnight doctor. Like the 4 p.m. shift goes until 2 a.m. And we have a physician's assistant, a PA, that's there from 8 p.m. until 8 a.m. to help, which is nice, because if you try to be at night in many hospitals, you may be like the only doctor on. So you're in the ER, they have an emergency on the floor, you go up to the floor. Somebody has another issue, then you go back downstairs, you take care of that patient. And sometimes you can be ping-ponging around the whole entire hospital, and you're it. So one of our other hospitals that I worked at, from 7 p.m. until 7 a.m., actually really from 5 p.m. until 7 a.m., there was no other doctors in the hospital.
Wow.
So it's just the ER docs. We'd have a doc there until 10 o'clock, and then you were on your own from 10 p.m. until 7 a.m. Again, we covered, like, there's a PA, so a physician's assistant that's in the hospital for the medicine service, but if there's like a cardiac arrest or something else, then we would get called to deal with that too.
Questions, guys?
Is there anything like you dislike about your job or something like?
Oh my God, yes. It's a really, that's a really good question. where do I start? How much time do we have? The things that suck about medicine, right? Medicine is great in that we get to, I meet total strangers and ask them to trust me with their life. And, I get to make a difference. And I enjoy that every day that I'm there. At the same time, there's a feeling of entitlement by a lot of people. I say this is not Burger King. I don't do medicine your way. It's hard for people in our society right now. People think, well, I'm going to go to the ER. I want a note for work. You can go to work. There's no reason that you can't. Well, I want this drug, or I want that drug, or I want this procedure done, or I want this CAT scan done because Dr. Google told me that it's my appendix. I don't care what Dr. Google said. That becomes very difficult. So you're dealing with an infinite number of personalities and perceptions and people who have certain desires and wants. And oftentimes we're the people who tell them, no, that's not going to be that way. And we have to do that. My job is to keep people safe. People don't always like that. At the same time, the hospital says, well, we want your money. So if we don't give this person what they want, they're going to go to Lehigh Valley and they're going to get what they want there, and then they're going to be a Lehigh Valley patient. So we don't want to lose that patient. Why wouldn't you just do the CAT scan? So there's that kind of pressure, which isn't horrible at St. Luke's, to be honest, but it's there. If somebody complains about you, I'm going to have to hear about it, email after email after email after email. That's part of the job that I don't particularly like. The legal aspect of it, it's there, it's real. I don't practice medicine differently because of a fear of being sued. I have been, I will be again. It's just one of those things you kind of have to deal with. Let's see, what else? This whole pandemic has screwed medicine up, and like this stuff. And 5 years ago, did you ever think you were wearing a mask in school?
Nope.
How long were you guys shut down for?
We shut down March of 2020. We didn't come back to school for that. And then the following year, it was you can either be in person or you can be full remote. And then we shut down like 2 weeks around Christmas. And then same thing to finish out the year. This is the first year that we've been full in person again.
That's good. At least that
Yeah.
much. It's hard to follow. I have small children.
Okay.
Their daycare has been open the whole time.
Okay. Right.
Because there's a lot of healthcare workers
Sure.
who send their kids there. So that was nice.
That is
Yeah, they knew that without that we wouldn't be able to go to work. But
right.
who would have thought that
This
this would happen? It was the same thing in healthcare. For the emergency department, it was the opposite. We were slow.
Mhm.
The first couple of months of the pandemic, people weren't coming in. People were dying at home. It was horrible. People, you're trying to convince them that they put out these wonderful signs. They give us these. They give magnets for us to put in our cars. We go to work so you can stay home.
Mm.
And all of a sudden, we're noticing people aren't coming in. There's no less strokes. There's no less heart attacks. People may not. People.
I just noticed that if you're still in the building, could you please dial extension 50008? And just notice that, please dial extension
Nobody here?
50008. Thank you.
People got scared and stayed home, and people got more sick, and that's what we're catching up from right now.
Yeah, you're right. You don't really think about that because I don't know, like I'm not in your shoes. So like, yeah, I stayed home. Like I barely went, you know what I mean? But you're right.
Yeah,
it doesn't change the effects of the normal everyday stuff that's happening.
No.
So
This is something that as you guys grow up and into society, somebody's going to write a book about how horribly managed this whole pandemic was. Like on the healthcare side, we knew this was coming. Like I've been, you guys know the movie Outbreak? Generational.
I've heard
But-
it. I've heard it.
So it's a movie essentially about, the most similar thing would be Ebola, that somebody got infected by a monkey and then it spread and they quarantined a whole bunch of people. That came out when I first started in EMS, and a whole bunch of people quit. They're like, oh my God, that's really going to happen.
Mhm.
I lived through HIV and AIDS and other things that were relatively new when I was starting, and people got scared and ran away. So right now, we have a healthcare crisis that's being caused by the pandemic, and a pandemic that's kind of also causing the same thing, if that makes any sense. So it's very difficult now. People still don't want to come to the hospital. People come in with 5 layers of masks on and 4 layers of gloves on.
Yeah.
I'm going to leave here and I'm going to go home to my son's 2 years old. He was born the day the hospitals closed down. Like I'm going to go right home to my kid. He's going to be fine. In fact, he's had COVID twice now, and he's fine. So, I don't like that either. We need to move on.
Yeah.
Keep learning, one of the two.
So not to get personal with them, but like a big
No, get personal, it's fine.
misconception is like if you're a doctor, like you don't have time for a family and all that kind of stuff. Like
Oh,
you have a family.
I think, yeah.
So
No,
like
yeah.
explain to me like working these kinds of shifts and stuff, like again, not to get too personal, but like has
No,
that
it's
kind of
fine.
effect on like your family and like all that kind of stuff.
Work-life balance is something that's incredibly important, and I don't think it matters what you do. I mean, I think if you find things that are important to you, you make time for those things that are important to you, and medicine is no different. I work with people who, like, all they do is work. Like, I know people who pick up, so, emergency medicine is shift-based. It's on Monday through Friday, it's not office hours, but I'm contracted to work technically 15 shifts or 14 shifts a month.
Okay.
I know people who work 20. As a resident, I had to work 20. So residency is a little bit different because they're trying to teach you how to work tired, and they're also making money off of cheap labor. They pay us on average, I think it ended up being like $4 to $5 an hour. So it's cheaper than what they're paying a regular doctor. I ended up getting divorced in my second year of residency, and partially because of the stresses of residency. At that point, you're really never home. Like I was working 100 hours easily a week, and I used to work like a trauma service. You switch from month to month the different services: trauma, cardiology, surgery. I used to call it was 5 a.m. till God knows when. Sometimes I get home at 10, sometimes I get home at 2 in the morning, and then I'd be up at 3, 4:30 at the latest because I have to be back by 5 to see the patients from the night before. So that's very difficult. Outside of residency, though, it's all about what you make it. So I'm married now. I have an 11-year-old from my first marriage. I have a 4-year-old and a 2-year-old. I may not be able to get to see everything. Like, last night I missed gymnastics. Friday I'll be able to make it up and do something else. So I think that's a life lesson. And I'm sure you hear teachers talk to you about time management all the time. It's like anything else in life. If you don't manage your time gets away from you. But if you make the time for what's important, I don't feel like the things that I give up for my family, some years Christmas is 2 days later. Sometimes Thanksgiving is the day after or the day before. Those things suck because you get to see all of your friends with their families. And if I had an office, maybe that's how it would be. But at the same time, my work family is another family. We spend more time together than we do with our actual family sometimes. So we celebrate Christmas on Christmas, and then I get celebrated again the day later with my kids. So it's truly what you make of it, and how you manage your time and what you choose to do with it. But it also affords me a lot of opportunities. If I work harder, I can play harder too.
I like that because you just hear so many kids talking about like, oh, like I don't want to be a doctor. I don't want to spend all that time going to school. I don't want to never be home. I don't want to do this. I don't want to do that. It's always, negative, but it's not always. Like you said, you have to make the best out of it, and you're picking and choosing what you can do, what you can't do, and what you want to do. So it's very doable. So don't let that kind of deter you from not wanting extra education or anything like that. Good.
I wouldn't give up what I did for the world. I took kind of a weird path into it. My military service in Israel cost me 5 years of my life, but it's experience that very few people will ever get. I lived through it, so I'm happy. And I would do it again. We all make different decisions, but I don't regret. I used to hate, like I would talk to doctors in the process, and they would all try to talk me out of it. Like, oh my God, anything but medicine. Go into business, get a degree in something else. It doesn't help. If this is what I want to do, this is what I'm going to do. Now I just feel crappy about doing it. But it's a great profession. It really is. I'll meet 40 new people in the next 10 hours. Sometimes that's good, sometimes that's bad. But of those 40, if 30 of them are nice and 20 of them are really nice, be really odd. Maybe 10 of them are really nice. You get to help one. I'll take that. It's good. There's people who are walking around now who wouldn't be if I wasn't there whatever day I happen to be there. That's a cool feeling.
Now, as far as like education, like how much education do you need to like continue every year to like stay active, and like is there like special requirements? Does St. Luke's pay for like any of that, or do you have to pay like for that on your own? Like what kind of stuff is available like that?
Depending on what your specialty is and where you work, there's a certain amount of continuing medical education that you have to do annually to keep your license up. So we renew our licenses every 2 years in the state of Pennsylvania. Like DO is 1 year, MD is the next year, so we rotate. And most of the continuing medical education, the hospital pays for. But essentially, I have an account. I'm going to a conference in Florida in April. They'll pay for that conference. That conference gives me a certain number of hours that I need towards my CME's continuing medical education. The rest I fulfill with podcasts. Like on the way here, I was listening to it's AMRAP, Emergency Medicine. I don't remember what it stands for. Something in Perspectives. Review in Perspectives. So it's a podcast about, this one is just, updates on different studies that are out there. You take a test afterwards and you get continuing medical education for that also. But there's no real expense offered. It used to be they give you cruises and stuff. Like, here, come do your CMEs on our cruise and this drug company will pay for it. Unfortunately, that's no longer the case. But the hospital reimburses for it, so there's no out-of-pocket cost. And then you talk about time management. So I'm going to Florida in April. You get a hotel room that's paid for. My flight's paid for. You want to bring your family with you. Most people do. Then they can go play on the beach while I'm in class. After class, you skip half the time. Then you go meet everybody and go back to the beach. So it's another way where I wouldn't say see the world, because most places won't pay for international stuff now, but you get to see the country for free. Move around a little bit.
About like spending money for your education. Like,
yeah, it's a good question too. Yeah, go ahead.
And a lot of people are kind of like deterred from that. It's so expensive. But what do you think would help, like, limit the finance, all the cost?
The education itself is not something that I see changing as far as cost goes. So I did 4 years, I guess 4 years of undergraduate. I did a master's in my 5th year while I was working full time, and then went to medical school. In that 9-year period of time, the cost went up on average 10% per year, which is ridiculous. I mean, ideally they change that, like how much it actually costs, which I don't really see happening. One of the reasons I ended up coming back to the U.S. instead of staying in Israel and studying, where I could have paid $1,500 a year there for my medical school. I came back here because it allowed me the opportunity to work and live at the same time. Whereas there I could either go to school, which would be work, or I could pay to live. I couldn't do both. So you have to, depending, everybody's got different financial situations. Like, I know people whose parents paid for them to go to their undergraduate, their graduate, and medical school. And then there's me. I took loans for everything. And I worked full time doing it. Like, I worked 50 hours a week when I was in medical school because I had no choice. One of the smartest things that they said in medical school was live like a student today so you can live like a doctor tomorrow. The only thing that you can really do is use your resources to the best of your ability. As you start getting into like college, look for the opportunities to make money while you're learning. That's not going to detract from your ability to learn. And then get through school as fast as possible. As stupid as that sounds. And I know that's changed some in some places also, but like it works on a credit system. You needed, I think, 120 credits to graduate, but there was no limit on how many credits you could take per semester. So I would take 24 credits a semester.
Oh my God.
Yeah.
18 was my max, and that's a lot.
Oh yeah, 18 is a lot. 18 would have been normal. I'd have been.
Wow.
And then it didn't help me get through any faster. It just got me all the classes that I needed. I mean, like I graduated with enough credits to get 2 degrees, and it didn't cost me any more. So
That's smart. That's smart.
Yeah, I mean, there was a state system. I was in Maryland, and that was what they allowed. But I hear that some colleges now like limit you at how many.
I think I had to pay extra because I was taking like 18, or like if you took 19 or something, you had to pay more. Like there was a limit.
Yeah.
But I went to Misericordia, which is in Dallas, so it's the Catholic's like university. But wow, crazy. Again, without like you telling us specifics, like since we're talking about financial stuff, can you give us a general idea, like, a doctor's salary as like a family medicine doctor versus like some of the other specialty areas, like what the difference of that salary was?
Yeah. The highest paid doctors, well, you want lowest paid or highest paid first? The lowest paid are pediatricians.
Yeah, I was about to say.
And it's, so your office-based medicine tends to bring in less revenue. And it's always interesting to see how the dynamics shift in medicine. Like the business of medicine is interesting to me. Not something I really want to get wholly involved in because it would drive me nuts, but you have to understand enough of what's going on around you to be able to maneuver your way through it. So family doctors and pediatricians tend to make the least, and the least being somewhere in the area of like $100,000 to $120,000 a year would be the rock bottom salary that I've ever seen for either. The best paid are neurosurgeons, last I looked, and they're around $1 million, 1.2 million per year. But you're talking about 12 years of training. So a lot of us, what we'll sit down and do is, you look at, you spent 4 years in undergrad, you spent 4 years in medical school. After your 4 years in medical school, that time in residency is where you start feeling like you're losing money. So the average resident gets somewhere around $40,000 a year. The highest paid residents are around $60,000 a year. And then you start looking at the attending salaries and you're like, well, if I spent 4 years in residency, it's going to cost me this much money. If I add 6 more years in residency to be a neurosurgeon, it's going to cost me that much more money that I'm not making as a surgeon outside of it. So, yeah, I mean, it's another smart thing one of the doctors in medical school said to me is, the NFL players have nothing on us because they're going to go play for 5, 6, maybe 8 years and make a lot of money. You're going to work for 35 years and you're going to be in the top 1% for that whole 35 years that you're out there. So we get paid well. I'm not going to say that we don't.
Sure.
Emergency medicine is in probably the top 50% of specialties, which changes also. You look over time, emergency medicine used to be paid nothing. But now we're kind of like the front door for the hospital. Everything comes through us. So that helps. Does that answer your question?
Mm-hmm. Yeah. So you won't be in debt forever is what you're basically saying.
Oh, I don't worry about the debt. I don't care about the debt.
Right.
Like it doesn't affect me. If I compared my mortgage to my school debt, my mortgage is 2/3 as much as I pay every month in school loans. But I make enough money to pay it. And I'm not killing myself working extra shifts. I work extra because I have to cover the shifts that are open, but like on a month like this, I'm working 10 days. So I'll have 18 days off. My salary doesn't change. In April, it's a 30-day month, I'm working 10 days. My salary doesn't change.
Right.
January, I worked 14 days. So it's a cold month.
It's a balance. Yeah.
Yeah, I hate the cold. So I was fine. I'm like, yeah, I'll pick up extra shifts. Other people want to go skiing, be my guest, have fun. Beach season comes around though. Yeah, I'll work 10 or 11 days a month. I still pay my school loans. I pay my mortgage. Both my kids are in daycare. My third kid's in a private school. I don't drive a fancy car. If people want fancy cars, there's you can go to plastic surgery. Dermatologists make about $1 million a year. But if you said you can make 1/3 as much as a dermatologist and do what I do, I do what I do for free. I like what I do. I don't think the money makes up for enjoying yourself. You just become a really crappy doctor.
Oh, yeah.
Money's not the right reason to do it. But it helps. It does make it worthwhile.
So we have had Stephanie Rosenberg.
Yeah, she told me she
came
came
last
by.
time. And I know that we have a few other professions and I don't know names, but people on the list. But so let's say temporarily that you did not like your job and you did not want to be an ER doctor anymore. What could you do? Like,
Go
you know
back
what
to
I mean? 'Cause
construction. So that's also a very, very good question. So if you look at, I'd say levels of providers, but if you look at nurses, they call them mid-level providers or advanced practitioners, I think is the new politically correct term, and then physicians. So a nurse, nurses have, they have an undergraduate degree, which is either an associate's level degree, so a 2-year degree, or a bachelor's of nursing, so a 4-year degree. And then they can add to that a master's, which would make them a nurse practitioner. They can independently practice in family medicine and acute care, I think are the two that they have tracks for. As a nurse or a nurse practitioner, you can go anywhere in medicine. You decide you want informatics. I know a guy actually a girl who works for GE. She flies around the world setting up CAT scans. That's what she does. She's an RN. She's been every place that you could ever imagine and a couple of places you couldn't. That's the portability she has. I met her when she worked at Shock Trauma in Baltimore. I worked there for a couple of years. She was a trauma nurse for 10 or 12 years and just decided one day, screw this, I'm tired of the hospital. I want to get out of the hospital and go do something different. So that portability is amazing. Like if you want to do a little bit of everything in medicine, nursing is wonderful. The more specialized you get though, the less portability you have. Nurse practitioners or PAs, so you have physician's assistants and nurse practitioners, they probably would get upset with me saying it, but they're essentially the same level of provider. PAs can work anywhere that a doctor works. So I know PAs who are in orthopedic surgery, I know PAs who are in We have PAs that work with us in the emergency department. There's physician's assistants that work dermatology. I mean, you pick a medicine service of any kind, you can have a PA on that service. So again, portability. I know one that I started with in the emergency department. Now she's doing urology. So she just found another niche for her somewhere else. But it's office hours, so she wanted to get away from that. She just got married. She wanted to start her family, and that gave her the ability to do that. So NPs, PAs, also a lot of portability. Doctors, we're stuck. Like could I technically, so let's say today I walked in the emergency department, I tripped, I fell, I broke my arm. I couldn't use my arm anymore. Can't really practice emergency medicine. I could go become a general practitioner. So I could go out, open an office and see patients and deal with blood pressure and all that kind of fun stuff that they do, which is important, don't get me wrong, just not my speed. But I could do that. Or I do know one guy, well, I know two interesting ones. One was a dentist, and he got so tired of being a dentist, he went back. So they do like the first 2 years of medical school are the same, and then they go into dentistry stuff. He went back, finished the last 2 years of preclinical medical education, and then did another residency in emergency medicine. And now he practices as an ER doctor. So good guy if you have a toothache and an ED. It's nice to have, actually, but a rarity. But you would technically have to go back and do a whole different residency. So you're talking about an additional 3 years of making much less money to go through that whole process again. And there are people who do that. I know people who are surgeons who are now ER doctors. I know people, let's see, that's probably the biggest one that I've seen. I've seen one ER doctor who went back for orthopedic surgery. He just decided he'd want to rebuild people instead, so he did that, but that's an additional 5 or 7 years of residency on top of it. So there is that possibility. The other thing that we have, so I'm an emergency medicine physician. That's my board certification. I have a subspecialty in emergency medicine. And now I'm adding a subspecialty to that of emergency medical services. Now, really doesn't change my job. I'm the medical director for seven different EMS agencies, and right now 1 fire department. So it's going to give me another certificate. So something else to put on the wall. But in emergency medicine, there's also toxicology. There's dive chambers, hyperbaric medicine.
Oh, okay.
So toxicology, hyperbaric medicine. There's an informatics subspecialty now. There's EMS, and I know I'm missing at least one. There's pediatric emergency medicine also, so you can subspecialize in peds. You can be like a pediatrician and do an emergency medicine fellowship, or do an emergency medicine residency and a pediatric fellowship, kind of crossover. And then there's also critical care. So one of my friends is an ER trained physician who does critical care. So he works in an ICU also. And then there's people like right now I'm pursuing a commission in the military just to add one more thing to my list. So I can go, it's a critical care air transport. So they run an ICU in the back of an airplane. Go pick people up and bring them back.
Awesome.
There's all sorts of stuff to do. Did I answer that question?
Yeah, absolutely. And again, like they wouldn't know half of this stuff, like, you know, being in high school and all that kind of stuff if you didn't have some resources and you didn't, because, you know, I don't think you ever would have assumed with Dr. coming in today that like he had all these different experiences, because you're not to be, but your average doesn't have a path like he does, you know what I mean? So like, it's really nice to see like some of these alternative kind of routes and things that you've accomplished throughout your time in medicine, and kind of be an example of what's outside of the box too.
Yeah, and it's interesting. Like everybody has a different pathway into medicine. Like for me, at least, mine is different than one of the guys I'm going to work with today, who went straight high school, college to medical school, residency. He's out. So he's 30 years old and he's working as an attending. I'm not 30 years old. Wasn't when I started. I was 30 years old when I started medical school.
Okay. Which is also awesome too, because like, you know, you're never too old to kind of change your mind or your decision on what you want to do, and, you know, give up on anything. So.
There's no right pathway in. It's just what's right for you.
Absolutely. Do you guys have any other questions or anything else that you want to know about?
Well, just out of curiosity, what's like one of the craziest patients? Like, you know, I was thinking
crazy in
You
which
knew that was coming.
crazy in which respect? I usually get, what's the goriest thing that you've ever seen?
I did hear that maybe you were bringing pictures.
Yeah, I decided not to,
Okay,
but
that's okay.
I didn't. I was trying to think what would be too politically incorrect, and I don't really understand political correctness in general. So I was going to bring, I have interesting X-rays, which are fun to look at. But it's 29 years of doing this stuff. So as a physician, what's the craziest thing I ever saw, or ever?
Whatever comes to your mind.
I think I call it the power of forget. So this is, I drive an hour to work, and during that hour going to or from work, during the ride to work, I tend to listen to podcasts because it's a good time where it's quiet, or I'll, catch up with friends or whatever. And going home, I forget about work. I don't bring work home with me. So it becomes kind of difficult to remember like the craziest thing that I ever saw.
Yeah.
Do you have an example? Like, have you ever seen? Because I don't know, like my normal is your crazy.
That's
Your emergency is my run of the mill.
Good point. What did we see on Grey's Anatomy?
Everybody keeps asking me about Grey's Anatomy. They can honestly tell you I've never seen Grey's Anatomy, so I don't know what might have been on there.
I could start watching. You watched it.
Yeah.
Um,
I know, like, I volunteered at a hospital, like the Monroe campus one,
yeah.
and I was like getting wheelchairs, help people in
Mhm.
after like lab work and stuff. And one time this guy came running in and like he had like blood all over his head, like his shirt.
Yeah.
And something happened like during construction, like a nail. Was in his
Got a
head.
nail gun to the head.
So that's like the craziest thing I've seen.
That's a pretty good one. That happens sometimes. I mean, the X-rays. I think that the X-rays that I was going to bring in was a guy that was stabbed in the eye.
Ooh.
Yeah, it was from a prison too. So it was a prison shank to the eye, but the X-ray you can actually see it going back into his brain. We can do that another time. I'll be happy to come back
Hey, that'd be awesome.
with either
That'd be
X-ray
awesome.
images. I just didn't know what would be right, and Jen didn't really give me any any good indication.
That's okay. That's okay.
Trying to think what the craziest thing. I mean, in the military, I saw people blow themselves up and take 22 people with them. That was a bad day. The most patients I ever saw in a day was somewhere around 1,200. When there was we were on the outside of a village, and inside the village there was a lot of fighting, and we were taking care of all the people who were leaving the village. So I also laugh about that now. We have, we'll go through 150 patients. 156 patients is about our busy. 150, 160 is like a busy day in the ER here. Yeah, like I've seen 1,200 in a day, so it's fine. Yeah, I don't know. It's a hard. I don't. I can think of like the most disgusting patient that I ever saw. If that's the kind of thing that you're looking for. If you like the gore.
Stories are cool.
What's that?
Stories are cool.
So I used to work at shock trauma in Baltimore. It's there's level 1 trauma centers, and then there's what's called a primary event resource center. So level 1 should be the highest, but somebody had to be bigger than the level 1, so they came up with what they call a park. But during the wintertime, they're not busy, so they do a lot of soft tissue surgeries. So let's say people with infections, a lot of times those infections, the only way to get them to heal is to cut the dead skin out. So you're cutting out dead tissue. And they sent a person to us who he was a little demented, so on the older side, like in the 70s. And he got up to go to the bathroom, and his penis fell off. So he picked it up and threw it in the trash can and didn't think anything of it. So his wife came and found him, and it's like he's just oozing. It's just dead tissue that was oozing from him. Called 911. They brought him to the local hospital. The local hospital flew him to us. And by the time he got to us, there was just this big cavernous hole. You can pretty much see like his whole pelvis,
Yeah.
like everything bony you could see. And that was bad. I could smell the guy when he came off of the elevator. But the worst part, so the doctors, we're not always smart people. We're not always good communicators. So this woman comes in, like grandma, a very sweet, like 70, 75-year-old lady with her sweater on. And she's walking in, and they walked over to her and they're like, "Ma'am, you have the penis with you." And she looks at him, she's like, "Why the hell would I bring it with me?" It's like, "Well, we need to send it to pathology to see if this is cancer or something else." And she looks at me and like, "Did he really just ask me that?" I'm like, "Yeah, why don't we walk over here? We'll get you a cup of tea. Everything will be fine." So I don't know which was more gross, the patient whose body parts were falling off, or I'll call him an idiot physician who asked this poor woman if she brought her husband's body parts with her to the hospital.
That's Grey's Anatomy-ish, I think, right?
Oh, I got Grey's Anatomy beat, I'm sure. Reality is, we always say fact stranger than fiction. It's always interesting to see what stupid things people will do to themselves or to others or both. That's what makes
Say
the job
which makes it
interesting.
cool though too.
Yeah. You never know. Every time I think, like, I started this when I was 16. It'll be 30 years in December. Every time I think, nah, I've seen it all. There can't be anything else. There's something else. That's what it really is. What makes it fun. Everything is different.
That's really awesome.
Now, I know that Stephanie had mentioned, and I need to reach out to Jen also, but she was mentioning about like shadowing opportunities.
Yeah, we've done that before. I don't know how they're doing it with COVID.
So reach out to Jen and kind of see if anyone's
Yeah.
interested and how that would work. And
She's
all
going to
that
have to
kind
go
of
through
stuff.
the administration, but we've had
Okay.
high school students come in pre-COVID.
Right, because I know like the volunteering and stuff exists, and I know that there's like special programs and stuff that they can apply to, but she was pretty like open about like how welcoming you guys are to shadowing. And
Us, like
yeah, like a
so-
St. Luke's and like
Oh yeah.
in
We,
general and stuff like that.
We call our little charting area, like where we have our computers, we call it the doc box. So everybody in the doc box is incredibly friendly.
Nice.
And I would say that our nursing staff right now is kind of in flux, which sucks. We have travelers, so people who are nurses from other places who are coming to work for us, because our nurses have come to work as travelers in other places.
Right.
That part makes it a little bit more difficult because it should be a mix between a provider and a nurse.
Right.
But Jen's a good person to talk to.
Awesome.
She'd be
Okay, yeah, I'll
really
reach out to her.
good.
That's great.